Now I'd like to turn to the study itself. What did you do and what did you find?
Following the selection and validation of the vitamin D point-of-care test, a framework consisting of a data collection sheet, standard operating procedure, and action plan record for pharmacist-led vitamin D point-of-care testing was developed and validated. The framework was piloted in a community pharmacy with 80 participants, and patient data was correlated with the point-of-care test result. Data was analyzed using the chi-square test. As to the results of the study, of the 80 participants, 49 had insufficient and 8 had deficient vitamin D levels. The framework developed was practical to be applied in the community pharmacy setting. Participants suffering from chronic conditions are more likely to have their vitamin D levels tested, those suffering from metabolic disorders being even more likely to have deficient or insufficient vitamin D levels. And this correlation had a p-value of 0.026, showing its significance.
Interesting. And could you explain some of the practicalities of vitamin D point-of-care testing?
Certainly. So, approximately 20 microliters of fingerstick whole blood was required to carry out the test. The blood sample was collected via capillary action and transferred to the test cassette. The result is obtained after 10 minutes by comparing the intensity of the line on the test cassette in comparison to a color card provided with the point-of-care test kit. It is crucial that the test is carried out in a well-lit area for clear color comparison.
So what were the cutoff values for insufficient and sufficient vitamin D levels?
So in Malta, serum 25 OHD reference ranges follow those proposed by the Endocrine Society in the USA. Their guidelines state that 30 nanograms per milliliter are considered adequate levels. Between 20 to 30 nanograms per milliliter are regarded as insufficient levels, and below 20 nanograms per milliliter are deemed deficient.
So why do you think so many of the participants had low vitamin D levels? Many of us think of Malta as a very sunny place.
Yes, so despite the study being carried out within a Mediterranean climate, 71 of participants had deficient or insufficient levels of vitamin D. A positive association was observed between participant perception of the contribution of having sufficient vitamin D levels towards general health with sun exposure in terms of time spent exposed to direct sunlight. This finding indicates that participants who are aware that exposure to UVB rays is essential to vitamin D photosynthesis are more likely to spend time in the sun. This does not at all mean that it is encouraged to spend prolonged periods of time exposed to direct sunlight at times of high UV radiation. It is of detriment to advocate against prolonged UVB exposure, which leads to sunburn and DNA damage, in favor of use of sun protection during peak hours of UV, which in turn reduces vitamin D photosynthesis. There has also been an occupational shift over recent years, where the majority of the general population works from offices or their homes, and therefore sun exposure is restricted. Additionally, despite the fact that 38 participants were taking vitamin D supplementation, only 23 of those participants tested from community pharmacies were found to have sufficient levels of vitamin D, and there was no association between the two variables when statistical analysis was carried out. This may be attributed to underdosing of vitamin D supplementation, short duration of consumption of the required dose of vitamin D, and issues related to vitamin D malabsorption. Finally, half of the participants tested stated that they suffered from a metabolic disorder, where metabolic disorders considered included hypertension, hypercholesterolemia, hypothyroidism, obesity, and type 2 diabetes. Statistical significance was observed when the occurrence of vitamin D hypovitaminosis and the presence of a metabolic disorder were correlated, giving a p-value of 0.026. So there is quite a large significance there.
And is there a recommended dose of vitamin D in Malta?
So for a healthy individual, not having any other conditions, the recommended daily dose is 800 to 2000 international units of vitamin D daily.
Thank you. If vitamin D point-of-care testing were available from a community pharmacy, how would it be paid for and how much would a test cost?
The price of the test is primarily dependent on the type of test kit used. The test used in the study adopted a semi-quantitative test kit with a cost to the community pharmacy of €6 per test. A quantitative test costs approximately 14 to 27 euro, and in this case, an added analyzer may come up to an additional cost of 3,000 euro. One must also consider that test kits are bought as packs, and the community pharmacist must also factor in waste due to expiration and the test kit, and other consumables needed. For the chosen point-of-care test, consumables such as single-use lancets, alcohol swabs, plasters, a sharps container, result sheets, and patient information leaflets came at an added cost. Therefore, a business model must factor in all the above together, with the pharmacist's time and the time needed to cover advice following testing.
So the obvious next question is, what are the next steps for this project and for community pharmacy?
The next phase is the evaluation of the implementation of the test within a community pharmacy. So there are works in that regard, and maybe in a few months I'd be able to give you an exact number that you wish to get from the previous question. However, I would just like to highlight that it is our obligation as community pharmacists to educate and to do offer these kind of testing services within our pharmacy, to highlight our role to prevent and protect the patients within our community, and to provide individualized pharmaceutical care.
Dr. Catherine Anne Busuttil, thank you very much for describing this important study to us. That has been very interesting, and we look forward to hearing the next chapter. For more information about Dr. Busuttil's work, please visit our website using the links in the description. And please be sure to subscribe for more news, videos, and journals. For updates straight to your inbox, please follow the links below. And thanks for watching.